Hello, my name is Dr. Kelly Anne Nye, and I am a licensed psychologist at the University of Rochester Medical Center, working in the departments of psychiatry and neurology. I have the privilege of talking on epilepsy and mental wellness today, and I'm really looking forward to our discussion at the end. I'll be reviewing a few topics here. First is an introduction for all of our history buffs out there, and we'll be doing a historical overview of mental health and epilepsy. Next is mental health considerations. How do mental health conditions show up for individuals with epilepsy? And what symptoms should I be looking out for? And how can I cope with some of those symptoms on my own? And when coping doesn't seem like it's working well enough for us, how do I know when it's time to seek help? And how do I start mental health treatment? History informs the way that we currently think and treat certain disorders, but also lets us understand where we're coming from and why it's critical that we improve our understanding in an effort to improve the quality of life for individuals with epilepsy. And I'm about to give a very shortened version of events here for the sake of time, but I have many resources available that I'd be happy to share with you, and my email will be available to you all at the end of this presentation if you'd like those resources. So starting before the 17th century, many cultures considered epilepsy to be an expression of a mental health disorder. In fact, the Babylonians created a text that outlines details of what we call epilepsy today. However, it also mentions that these events were caused by evil spirits and demonic possessions leaving the body. And similar texts were found in Egypt, China, and other countries and cultures. This perception remained unchallenged until the school of Hippocrates. And Hippocrates is our Greek physician on our left, who's considered to be the father of medicine and was the first to attribute epilepsy to the brain, and was the first to write about the relationship between depression and epilepsy and how the relationship goes both ways. And although he was ahead of his time, unfortunately, his ideas had little influence over the supernatural beliefs over the centuries to come. And in the 17th and 18th century, more scientists started to write and publish books on epilepsy, and it started to become considered a medical condition that requires hospitalization and treatment. And before the 19th century, epilepsy was thought to be of a vascular origin, meaning from our blood. However, in 1849, Dr. Robert Bentley Todd introduced the idea that the brain functions through an electrical force and guessed that electrical discharges in the brain may be the cause of seizures. He was later able to confirm this idea using a magnetic electric device. And in the 20th century, other neurologists demonstrated that there were abnormal electrical changes before an event, and these discharges increased during the event. And even though we finally gained traction in our understanding of epilepsy, socially, there continued to be intense discrimination for these individuals due to the previous stigma in our history. But in an effort to reduce the stigma of mental health disorders in the epilepsy population, the pendulum swung the other way. And as our understanding of the biological factors of epilepsy advanced, providers tried to resist the historical stigma by explaining epilepsy as purely biological, and thus mental health problems were and still are often unrecognized or untreated in patients. And by the end of the 20th century, the World Health Organization and other epilepsy organizations recognized this gap in treatment and started to focus their objectives to address political and public awareness of epilepsy with the goal of reducing stigma and improving treatments. By the end of the 20th century, we see more researchers investigating the relationship between mood and epilepsy. However, in the 21st century, physicians and researchers were noticing a strong association with depression and epilepsy due to the quality of life issues. For example, there continues to be civil rights violations such as unequal access to health and life insurance, unequal access to certain careers, and problems in education, which is part of our social problem. But they also know that anti-epileptic drugs can both cause and treat certain mood disorders, leading us to understand more about the biological problems that you can see here as part of our pie. And then finally, we noticed that the quality of life issues were causing problems with depression, anxiety, and other things that might be going on in our lives and in our emotional lives that we can attribute to the psychological problems. All of this meaning that our perceptions of mental health and epilepsy have changed over time, and this affects our way of focusing our efforts on the best treatment recommendations. And additionally, it means that the factors that give rise to mental health issues for people with epilepsy are numerous and varied. And epilepsy and mental health are both located in the brain organ, and our brains are very, very complex, as we're all aware. So it makes sense that they would become closely related to each other since they live in the same house. And mental health problems are real, common, and treatable. In a general population, 1 in 5 people will have a mental illness each year. 20% of adults and 16% of youth will experience a mental illness each year. And it's often complicated by chronic conditions like epilepsy. And therefore, people with epilepsy are as much as 5 times more likely to have mental health and behavioral problems, with a prevalence of about 30 to 50% as compared to 8.5% of the general population. And in one recent survey of patients that were self-reporting diagnoses of mental health problems, they mentioned that anxiety, depression, bipolar disorder, ADHD, sleep and movement disorders were all most commonly reported. And it's important to note that some people with epilepsy experience few, if any, mental health conditions throughout their life. So I hope this is not all in an effort to scare you. Like I mentioned earlier, epilepsy and emotional disorders are both hosted within the brain organ. So epilepsy affects our brain, which affects our mental health, and mental health disorders also affect our brains, which can affect our epilepsy. We can think about these things differently or separately, but often they're 2 sides of the same coin, or is it the chicken or the egg? For example, if you have side effects from medication, you might notice that your thinking and mood are different, which can make us feel that we're not living a valuable life, that we're not doing well in activities that seem easy to others, or aren't able to engage in activities that we would like to. And when we feel like we don't belong or that we're different, this can lead to us having a combination of both internal and external factors playing a role in our mental well-being. So on our green side of our pie in this picture here, one way that epilepsy affects our brains is the use of anti-epileptic drugs. And although it's not common, if you notice a change in your mood after a medication change or a dosage change, then it's important to raise this concern with your neurologist or neuropsychiatrist if it's available to you, to discuss alternative medication options. And we can also see how altered brain activity can alter our way of thinking and feeling. For example, for some, right before a seizure, you might notice a feeling of intense fear, anxiety, panic, or even psychosis, where you might see, hear, or feel things that other people cannot. And right after a seizure, you might feel down, depressed, and hopeless for minutes, hours, or days to come. This would all be related to the structural components of the brain, although it can be worsened by already standing mental health problems. But living with a medical condition that is often unpredictable can affect our quality of life too. And this is our purple piece of the pie. Usually we see mental health problems arise due to the unpredictable nature of seizures and the worry that another might occur. In some cases, a diagnosis of depression after your seizures can actually increase the risk that you'll have another. And our way of coping often matters as well. The way that we were raised can help us understand how we cope now. And our problems in our social life and our sense of belongingness can also affect our mental health. So again, as I had mentioned that biopsychosocial model earlier, this all is connected and not to be thought of as separately. And our bodies also usually tell us something is wrong even before we have conscious awareness. Maybe you're noticing that you're sick more often, or that you've developed functional non-epileptic attacks, which occurs in about 10 to 15% of individuals with epilepsy. So tracking your health along with what's going on in your life can be helpful for unraveling problems that can be intervened on. How do I know when it's time to seek help? Here are 3 different domains that we can be paying attention to, which is our mood, our thoughts, and our behaviors. Our mood might be feeling down, depressed, hopeless, on edge, irritable for most days. Our thoughts might be, I'm a burden to others, life doesn't feel living, and I'm pretty worried about everything, or I'm really worried about what might happen if I step outside. And then our behaviors are, often what we can recognize most easy. So I'm not leaving the house, isolating more. Maybe it's been a few weeks before you've talked to any of your friends or family. Wanting to hurt yourself or hurt others with your words or your actions. Maybe that feels unusual to you. Risky behaviors like gambling or substance use are also an indication that maybe something might be off. Over or under eating or over and under sleeping can also be indicators that something might be worth checking into. So here are some tips and tricks for people with epilepsy, and also just anybody who's managing a chronic health condition. First are our short-term coping. These are things that you can do in the immediate time that you need it. First would be distraction. Maybe you're noticing a lot of tension rising. Maybe you're noticing you're getting irritable and angry. You can step away from the situation by removing yourself, taking a deep breath, going outside, distracting yourself with something that's helpful or valuable to you. I know a lot of people like to color, play on their phones, watch a video. All of these things are things that you can do immediately that can make you feel better. There's also short-term or long-term coping mechanisms. This is our marathon, not the sprint. These are things that you can do day to day to overall improve your emotional health. First is mindfulness. This is how you notice or feel things throughout the day, noticing what makes you happy or sad, noticing what state of mind you're in, and deciding whether or not that makes sense for you to change or to let it go. Next is exposure. Our brains are very good at keeping us safe and are safe from threats, I guess is what I mean. So when our brains perceive a threat, it doesn't quite know whether or not it is actually a threat. It just thinks that it is. So for example, maybe you're really afraid of crowds because you've had a really poor experience in a crowd before. Our brain is going to learn that that's very dangerous, and it's going to keep us isolated. And over time, that will lead to even more problems. So it's important to expose ourselves in a safe and comfortable environment so that over time, our brains can learn what is safe or not safe. Physical well-being is also huge, especially for those with epilepsy. Taking our medications on time, drinking water, having a good, nutritious diet, and exercise as much as that feels comfortable and safe for you to do. And then finally is belonging. And this means being in the community, being part of a family, being part of a friend group. It doesn't quite mean that you need to have belonging for people who also have epilepsy or also have mental health problems. It can be joining a community garden. It can be volunteering at a local shelter. But at the foundation of it all is not to let things build up. It's very easy for us to push down emotions, to tell people we are fine. But when we let things build up, it can cause not just emotional health problems, but also physical health problems. So talking to a friend, a family member, or a professional who you can trust with your emotions can help for you to release some of that tension and allow you to move forward with your life in a way that feels more comfortable to you. So here are some options for treatment. I'm just gonna make myself a little smaller here. This says neuropsychiatric care. So first is individual or group therapy, and next is neuropsychiatric care. And what we know from research is that a combination between having psychiatric medications along with individual or group therapy is most likely to help you to get better from any of the mood problems you might be experiencing. Individual or group psychotherapy is good for support and treatment of mental health problems. And some of the more common treatments are cognitive behavioral therapy, which focuses on identifying triggers for physical symptoms and finding ways to lower our threshold for having a seizure. And it can be used to discuss how our thoughts, feelings, bodily sensations, and actions are all interconnected. Techniques that are often used in cognitive behavioral therapy are distraction and relaxation and logging our thoughts, feelings, and emotions, and then the consequences of those things. And then we also have acceptance and commitment therapy, and that helps us to identify what is important to us in our life, what is valuable to our life, and how we can live consistently with those values despite having a chronic medical condition. And then finally is dialectical behavioral therapy. And dialectical behavioral therapy has been shown to normalize the part of our brain that's found to be dysregulated, especially for people that have a lot of anxiety or fear. And this usually the interventions used are mindfulness that I'd mentioned earlier, emotional regulation, distress tolerance, and interpersonal effectiveness, how to communicate with other people in an effective way. And then finally is talking to your neurologist. And neurologists are often really aware of the factors that play a role in epilepsy and mental health. And, hopefully they have some sort of access to mental health treatment and can refer you to those services. And in, some epilepsy organizations or departments, they will have a neuropsychiatric provider on hand. And it's best to do all of these things, not just separately, but together, right? So if you find that having an individual therapist, along with a psychiatrist to prescribe medications and a neurologist who's super helpful and in tune with what you're going through, can be really helpful to add to your team. And then finally is case management and social work. This is good for reducing the burden of managing multiple appointments and struggles that often come with having a chronic medical condition. So for example, I have patients that rely on case management and social work to help them get rides to their appointments, since often driving is a barrier for receiving treatment. And people often don't hesitate to talk about a broken arm, but it's often most difficult to talk to somebody about our mood. So talking to your team about how you're really doing in every visit can help you to get the services that you need. And so self-advocacy is within reach. You can educate others on your needs, like your doctors or your parents, your family, your friends, and the needs of your community, which can help us understand or can help us feel like we belong to something. And you don't have to do this on your own. You can have an organization or a group of peers to help you with this. And when a proper diagnosis is made, in psychotherapy and other treatments, or other people are on your team that can help you with improving your coping, it is possible to live a life that is valuable and consistent with your goals. And then finally, there are many organizations that are willing and motivated to help, similar to the organizations that are related to this conference, and then also many others. And finally, I just want to thank you for having me. I'm looking forward to our discussion, and below is my email in case you'd like to contact me. I'd be happy to chat with anyone. Thank you.